Hi everyone, Anna here with the Coding Guild. In this episode, I would like to share my tips with you on how to get ready for medical coding and billing exams. These are the methods I personally used to earn all of my 10 credentials, which I feel is a testament to their usefulness. But of course, we are all different, and something that works for me might not work for you. Just think about these ideas, try them on, keep what works, and throw away the rest. Before we begin, I would like to emphasize that the following 5 tips are unusual. They go against all commonly accepted advice, bordering on coding heresy. But if you are open to new ideas, this video is for you. Tip number 1, don't let your course dictate. There are several study styles, and your course probably has several of these mixed in it. There are visual elements, there are lectures, there is an ebook, hands-on exercises, quizzes, exams, some logical background information, lots of self-teaching, and if you are lucky, maybe even an instructor. And this is great that your course has variety. The problem arises if you feel obliged to blindly follow the course with no regards to your own study needs. The course says, read this material and grasp this concept from here, or listen to that lecture and you must understand it from there. But what if you are not an auditory learner? What if you cannot retain information that well just by reading? This is when straying from the course becomes necessary. If listening to lectures does nothing for you, then don't force it. If you need more hands-on exercise, then focus on the exams and quizzes and practical applications. And all this might sound trivial, but many students don't dare to step outside of the course's boundaries and then feel defeated when they are unable to progress using the course's rules. They say, oh, I don't understand this no matter how many times I read it. Well, then don't read it. Draw it, listen to it, talk it out with somebody else, write it out for yourself, self-teach, whatever your study style is. Another important thing to remember is that the course is there to serve you and not the other way around. If you need to rearrange the chronology of your course and jump ahead some modules and then back, that's perfectly okay. All is fair in love and war. And you might say, I cannot skip anything in the course because I need to know what's in there. And I agree with that, you do. Don't skip the material, but transform it to meet your needs. The other objection I usually get to this tip is that there is no time for individuality when it comes to coding studies. My answer to this is that fruitless learning, when you are forcing yourself to use a study style that does nothing for you, is the biggest waste of time. You might go through the motions in a lecture but retain nothing. The usual culprits behind using the wrong study style or sticking strictly to the course are peer pressure and self-doubt, the thought that something is wrong with you if you don't learn the same way everybody says you should. Next time when you have a hard time with a coding concept, ask yourself, am I using my personal study style that best benefits me right now, or am I trying to force myself into somebody else's pattern? Tip number 2, forget the clock. While you are studying and prepping, do not time yourself. When you time yourself, you create unnecessary pressure, which in turn induces panic. How effectively can you learn and mentally organize knowledge when you are panicking? Instead, take your time, explore the question and the possible answers. Why would one be correct and the other incorrect? Build a theory. Read all related guidelines, take notes, underline, understand what's going on. This will take much longer than simply referencing codes and answering the question, but because you put yourself through a problem-solving process, the brain will retain much more information from this experience. And next time when a similar question pops up, you will already have your notes and background knowledge and can answer it much easier. For example, we have to answer this EM question while timing ourselves. The experience will go like this. We read the question. The patient is seen in their home for their monthly checkup. An expanded problem-focused history, detailed exam, and low MDM are performed. The visit lasted 57 minutes. Okay, the clock is running, so better get to referencing these codes. The first code is a new patient in their home. The time checks out for this code, but the key elements don't. The next code is for a rest home, where the time is okay again, but the key elements aren't. Then a rest home code, where the key elements add up, but the time is incorrect. And finally, a home visit for an established patient with the elements being right, but not the time. I have about 30 seconds left, so I better pick something. Now compare this to the untimed method. We have the same question, but now we are under no pressure to answer. We can start exploring and picking it apart to learn from it. So the patient is at their home. This is our place of service. They are seen every month, meaning this is not a new patient. Then we are given key elements, but we are also given time. Why? Do they match up in the EM tables? No, actually they don't. So why are these here? Let's see the guidelines, what they say. See, we are actively allowing ourselves to explore the question, put our knowledge into practice, or build our knowledge when we recognize we have a gap. The result is that we understand the question, we recognize the trick behind it, and don't even need to reference the answers anymore. We can immediately go to the EM tables, find the right code, and pick answer D. And if you wonder why we didn't use the time to code this case, please check out the video in the corner and in the description below on time-based EM coding. The biggest objection I hear about not timing oneself is that I cannot not time myself. I will fail the exam if I don't build time management skills. And I respect that. But if you really feel the need to time yourself, please save it to the last minute, the last 2 weeks or so while working on your last practice exams, quizzes, and practical applications. There might be some justification for timing there, but there is none during your studies when you are still trying to put 2 and 2 together. Just forget the clock while working on course material. And speaking of courses, what if the setup of your course doesn't allow you to casually review the questions and think about them? In this case, you have to get creative. If there are unlimited retakes, and only then let the clock run out. You will fail the quiz or exam, but you will gain access to the material to review it at your own pace. And if you don't have unlimited retakes, then do your best with the timed exam, but then make sure to review the graded material on your own. Please note, I am not advocating for you risking your grades. Always work within the confines of your training, but try to get to the questions and answers in some way where you will have time to review them slower. Maybe talk to your teacher if you are in college, or ask AAPC to reset a failed quiz or exam for you. They do that. And remember, if you put in the effort on the front end and actually understand what you are doing, you don't need much time to answer questions. One needs either ample time or knowledge, not both. Tip number 3. Do not over-tab your books. When it comes to tabbing, less is more. The goal is to give yourself references on where information can be found and not to inventory the contents of the book. It can be helpful, of course, to add tons of tabs, especially while studying, but don't neglect to check your progress before you sit for the exam. You might have placed tabs during your studies that you just don't need anymore. By the time of the exam, you will probably know where everything is in your books anyway and can get rid of the clutter. I have already shared my best practices for ICD-10 PCS tabbing and can demonstrate the other books as well if there is need. For the currently available book tabbing tutorials, see the upper corner or the description below. Tip number 4. Don't fall prey to vanity. Vanity hinders studies in 2 possible ways. 1. By bringing about the feelings of abandonment and jealousy when you feel behind. The easy solution is not to pay any attention where other people are in their course. You might feel behind, but I guarantee that there are students who haven't even started yet. And in all honesty, it doesn't even matter. Whether or not Cindy has finished their course already has absolutely no bearing on your grades or final outcome. Knowledge is knowledge regardless of when you acquire it. And 2, perfectionism. We all like to have good grades, but this might cause us to waste valuable course resources, for example, practical applications and quizzes. The wasteful way of studying is to attempt the first version of a quiz, exam, or practical application, earn a grade on it, immediately retake it, if not 100%, then proceed to the next modules and finish the course. At the end comes the final exam and the course grade. The problem with this is that we have already used up all our practice resources before facing down the final exam. We created an information hole for ourselves right here before the most critical step. This does not bode well. A better method is to attempt the first version of a quiz or exam and then move on regardless of the grade earned. Finish the course, then go back to the beginning, start attempting the second versions of the practice material, quizzes, exams, and so on, because this will help you to review all the material before you attempt the final exam of the course. And you might say, but I can't do this, my course doesn't allow backtracking. If that is the case, then do your best on your first attempt, possibly untimed. Then, before the final exam, review your previously submitted quizzes and exams, but use the method described in tip number 5. That will give you plenty of opportunity to re-review the material in a meaningful way. If your objection is that by the end of the course you will have forgotten everything and could never pass the second versions of the quizzes and exams with a good enough grade, you have to remember that that is all negative self-talk. You are getting ready for your final exam and credentialing exam. There you will need all the material covered in your course. If you are ready for those, you are ready to retake the second versions of quizzes and exams. And finally, tip number 5, and please just hear me out on this one, as this will be the most contentious of all. Code from the index, not the answers given to you. I know it sounds crazy, just give me a second to present my case. Coding from the index is usually more in line with most courses. It is more accurate, and believe it or not, it is also faster about 75% of the time. Not to mention that sometimes coding from the index is your only option, but more on that in a minute. Let's look at my claims one by one. Coding from the index is more in line with most courses. I don't know if you noticed, but most quizzes and exams start their rationales by stating index XYZ in your codebook or reference XYZ in the index. They don't usually start by comparing the answer choices, and courses do this for 2 reasons. 1, this is how coding works, and courses are trying to teach us how to code. And 2, and this is the crucial point here, the questions were designed to be answered from the index. When AAPC says that every question should be answered in a maximum of 2 minutes and 16 seconds, they do so because they know that the index will lead you to the correct code almost immediately. Not always, but about 70% of the time. And AHIMA is the same. Why go against the design of exams instead of capitalizing on it? That's not logical. Let's see the second statement. Coding from the index is more accurate. We have an assessment here to code. It reads, the patient is severely obese due to excess calories. Discuss diet and exercise regimen. Alzheimer's is adequately controlled with Aricept. When we start referencing these codes in the tabular, bypassing the index, this is what we find. Answer A describes obesity due to excess calories, Alzheimer's disease, and dementia. It sounds great, although we didn't have dementia listed as a diagnosis. Answer B is obesity, not otherwise specified, and early Alzheimer's. The patient is 35 years old, but should that be relevant? Answer C starts with morbid obesity. We definitely didn't have that. Then Alzheimer's disease and dementia. Finally, answer D lists obesity due to excess calories and Alzheimer's. Just by the looks of it, it seems correct, 2 diagnoses corresponding to the 2 illnesses in the assessment. But is it correct? Let's see the index. Under obesity, we find due to excess calories and then severe. Surprise, surprise, severe obesity due to excess calories codes to morbid obesity. We would not have known that without the index. How about the Alzheimer's disease? We look under disease, Alzheimer's, and there are 2 codes. According to ICD-10-CM conventions, both of these codes will be necessary to describe Alzheimer's disease. Without using the index, we might not have known that this is the case. Of course, we still need to cross-reference our chosen codes in the tabular, but just from the index, it seems that the correct answer is C, morbid obesity, Alzheimer's, and dementia in other diseases. I also stated that coding from the index is faster about 75% of the time. But how is that even possible? Let's code for this case. Patient is seen today for colonoscopy. Hemorrhage control is performed in the transverse colon by ligation. Now we have two options. We can start looking these codes up one by one or go to the index for a quick solution. Please pause the video here and start looking these codes up just to see what the problem is with referencing codes. So by now you see that all of these codes describe control of bleeding or band ligation, and they do so in different parts of the colon. Even if you quickly eliminate answers A and C, there is still the choice between ligation or not, what will take time in addition to the time you have already spent on referencing all the four codes. Now, how does this compare to using the index? We go to colonoscopy, flexible, hemorrhage control, and done. Next example. A new foam mattress was ordered for the patient's hospital bed at home. Assign the appropriate code for this supply. Please stop the video and try referencing the codes. By now, you must have found that simply looking at the codes doesn't help because none of them clearly describes a hospital bed mattress. Let's try the index. Reference mattress, hospital bed, and we have two choices here. As we don't have E0271 amongst our answers, it seems that the correct one is E0272 for the foam rubber hospital bed mattress. Please note that your HCPCS index might look different. Every publisher has their own way of indexing these codes. And now on to the last statement made. Sometimes there is no choice but to code from the index, and just that on its own is enough reason to practice coding from here. This problem is especially acute for the following exams: CIC, CPMA, and CPB, and any AAPC specialty credentialing exam. More details on the specialty exam experience up in the corner and the description below. On these exams, you will often find questions where one of the answers is none of the above. Or on the CIC, there are not even options to choose from. It's all empty brackets for the cases, and we have to code them on our own. Some examples for your reference. The first one has the dreaded none of the above option, while the second one is an inpatient procedure with absolutely no answers given. Will coding from the index always work? No, it won't. There are some index entries that are counterintuitive and hard to find. Sometimes things are not even indexed at all, or they are leading us to an unspecified code that leads more work on our part. On the other hand, coding from the index forces us to learn and understand what we are doing, which makes us faster, more accurate, and last but not least, much more confident. I wish you the best of luck on your exam. For more help and coding quizzes, don't forget to visit our website. Thank you for being here with me today. I will see you soon in our next video.